We were interested in determining whether or not uterine fibroids are associated with increased risk of miscarriage or pregnancy loss. Our initial intention was to help identify which fibroids were the most likely to be increasing women's risk of miscarriage. It's an exceptionally common clinical belief that fibroids are a risk factor for miscarriage, so that if a woman has had a miscarriage and has fibroids, often the clinical belief is that the fibroid caused it, and this can lead to surgery. I'm a gynecologic surgeon. I wanted to know which fibroids mattered the most so that I could focus on those for my patients to help improve their pregnancy outcomes. So that was the motivation for the study. The surprising finding of the study, after enrolling more than 5,500 women, is that we don't see a link between having a uterine fibroid and having increased risk of miscarriage. The other studies had in common that they were predominantly clinical populations, so they were women who were enrolled in care, which tends to catch people later. That worried us that they might not be seeing all miscarriages, because many miscarriages are quite early, between the 4th and the 6th week. All of the women in our study had to enroll before the 12th week, but they enrolled at an average of around 8 weeks of pregnancy. So we have them, if that's the average, we have them very early in pregnancy in order to be sure that we can see pregnancy outcomes from the very beginning. Increasing age year by year confers very small but cumulative increases in risk of miscarriage, so that over time, as we get older, each of us has a higher risk of miscarriage. As we get older over time, year by year, each of us also has an increased risk of having a fibroid. And in some of the prior studies, those two things are tangled up. The increasing age that does drive miscarriage risk is tangled with the fact that fibroids appear as we get older. What we have found does not mean that no miscarriage is ever caused by a fibroid. There could be exceptionally rare types or locations of fibroids that could be associated. So the answer is not, don't ever think about intervening for a fibroid, but go cautiously and go with an intent to make an informed medical decision and to understand that that's your right as a patient, to understand the exact details of how a recommendation is being made and what are the risks to you and what are the benefits. It's great news for women. Our message when we talk about the findings of this study among our research team and with our friends and peers is women with fibroids now have one less thing to worry about. Because when something bad happens in a pregnancy, whether it's a miscarriage or another adverse outcome, the first thing we look to is ourselves. What happened? What could I have done differently? Why did this happen? And I think we're at risk of blaming things about ourselves, or blaming ourselves that if I had attended to this, or if I had gotten pregnant earlier, or if I had, that we now have one less thing to blame. A decision about whether or not you had a surgery for a fibroid is probably not driving the outcome of this pregnancy. Going into the next one, there's one less source of tension or worry. We don't see a link. So I hope that for women and their care providers, it gives them a strong reassurance that at least for that factor of the pregnancy, they can relax into it and enjoy having a healthy pregnancy, because this is not what will derail it.